Hello all, greetings to you on the World Hypertension Day. 17th of May is considered as the World Hypertension Day. Hypertension, as you know, is a silent killer. To bring about importance of this disease, the world has decided to commemorate or celebrate or talk about World Hypertension Day. All the general public should know a little bit about high blood pressure. Normal blood pressure is usually 120 by 80 millimeters of mercury. But the threshold to start medication for the doctor starts at the level of 135 by 85 or more. So to treat the patient, we generally ask them first to follow the lifestyle modifications. The lifestyle modifications include regular exercise, whatever is comfortable to them they can do. Easiest is walking, then reduction of body weight to maintain ideal body weight. How does one know about the ideal body weight? There are certain measurements. Based on that, one can decide about the ideal body weight. Then reduction of salt intake in the food. So not only the visual salt which is obvious, the hidden salt content such as preservatives in bakery foods, Chinese foods, pickles, packed foods, all these things would contain hidden salt. So not only the additional salt at table, one should take care of this hidden salt in their food items as well. That's why all the food items will have the amount of salt content in them on their printed label. So exercise, weight reduction, dietary control of salt, and in addition, one should abstain from alcohol consumption as well as smoking. So blood pressure is controlled with medications. Before that, we try to control without medications. If it is not controlled, then we control with medications and we continue. Regular checkups are needed. Compliance to medication is also needed. Once the blood pressure comes down to normal levels or within acceptable levels, a doctor may decide to reduce the doses of them. But generally it never happens so that all medications are taken off. Some medications would remain to keep the blood pressure maintenance dose, we call it as, continue for the rest of their lives. But of course, there are some people who maintain a very good lifestyle medications, and if the blood pressure comes down to normal levels, we may even stop the medications, but we keep an eye on them. Every 2 to 3 months we recheck, and as and when the first recognition of increasing trend of blood pressure, we may restart medications. And these days, I do observe another thing, that obese patients, once they undergo bariatric surgery, their blood pressure levels come down drastically, and we may even stop the medications of blood pressure. And blood pressure, as known to all of us, it's a silent disease, does not produce any symptoms, and it can stay for longer period unnoticed and without any medications. So an uncontrolled blood pressure results in the damage of certain vital organs which are called our target organs, namely brain, heart, kidney and eyes, and feet as well. Atherosclerosis of the feet and high blood pressure combined would result in problem in the limbs. Coupled with diabetes, which is rampant these days, peripheral vascular disease is also one of the problems. So to prevent all these future complications, one needs to control the blood pressure to acceptable levels. I wish all of you to have a good and healthy lifestyle to be followed so as to prevent hypertension, and as a result to prevent future complications of target organs. All the best.